This film looks back at the history of the antiretroviral or ARV program in Chiradzulu, Malawi. Back in 2000, ARVs were inaccessible to people living south of the Sahara.
By then it was like a bit challenging because it was like people would get tested, but it's like eventually there was no hope. There was like nothing that we could maybe offer in terms of treatment, and so it was like, okay, you get tested, you know your status, and then what happens next? Yeah. But in 2001, when this MSF launched this ART program in Chiradzulu, things started to change.
The number of patients on the ARV program in Chiradzulu has risen from 500 to 30,000 in 10 years. Testing, adapting and innovation have been an essential part of that process. The first step was decentralization, bringing HIV care closer to patients' homes.
MSF introducing the mobile teams, which could go around, the health centers, comprising of maybe like clinician and also a nurse, and also a counselor who could go out in the villages, in all the health centers of Chiradzulu, and also like to treat people.
Today, MSF works in the district's 10 health centers as well as the hospital. The organization also introduced task shifting, a scheme designed to make up for the lack of medical personnel by training nursing staff to identify and initiate patients on ARVs. The third step was the 6-month appointment system for stable patients.
It means that the patient comes every 6 months to see a nurse, but every 3 months to see a HSA, which is a health surveillance assistant.
The other important aspect of the program is the psychological and social support provided in all the health centers. At each appointment, a patient will see a counselor to talk about their medication, ask questions and discuss any family support or stigmatization.
And now we've seen like patients, they have good life. They're able to maybe to take care of their families. They're able to to work again, to work in their gardens. So it's like now, even if one has HIV, but it seems that life still goes on.
Access to ARVs has made this once deadly disease a chronic one. MSF is determined to keep providing patients in Chiradzulu the best care possible. To ensure this, despite the fact that international funding is on the decline, MSF has implemented World Health Organization recommendations.